And when you need medical care fast, especially now during flu season, Denver's Health Urgent Care program has you covered. And here to tell us more about it and how it works in the sponsored segment is emergency medicine physician Dr. Michael Breyer. And thank you so much for coming to Great Day, Colorado.
Of course, thanks for having me.
So first off, tell me a little bit about yourself.
So I'm an ER doc. I work in the emergency room at Denver Health. I also work in a number of urgent care settings as well.
And talk about some of the urgent care visits that you have. Typically, what are you dealing with when they come see you?
A number of things. Some minor abdominal pain, if you need stitches, if you have an ankle sprain, cough and cold, of course. It's flu season, so a number of patients with flu as well.
How do they know, like, okay, this is the time I should go to the ER? Like, my stomach, it could hurt, but you know what? Maybe I didn't have enough fiber, so maybe I should just sit at home for a little bit longer.
Yeah. It can be a real challenge for patients to navigate that. Some things that might steer you to an ER versus an urgent care are extremes of age. So if you're a little bit older, an ER might be a better setting for you. Severity of symptoms. If you have real severe symptoms, obviously an ER might be the best place for you. Or if you have past medical problems as well, an ER might be a better place for you.
So what makes Denver Health's urgent care and the team there such a little bit different apart? Why should people come to see you? And you treat differently adults and children's pediatric care, right? Yeah,
that's correct. So our specialists, we have specialists in urgent care and emergency medicine, of course. We are all trained to take care of adults and kids alike.
Good.
All our rooms are pediatric or kid friendly as well. We have iPads. We have coloring books to make your child stay more comfortable. And then our award-winning pediatric emergency department and urgent care also has child specialists there too, again, to make your child's visit as comfortable as possible.
And honestly, that's a big deal because the child is already nervous. Mom is nervous taking the child in, and the child can feel that.
Yeah.
So it's good that you have that warm environment and plus the award-winning physicians, thank God, that are there to take care of them. So what would you suggest if there's somebody at home and they're thinking, okay, this is minor, I can take care of this at home, and they don't go to urgent care? What would you tell them?
It really depends on the complaint. If you have a minor scrape or abrasion, wash it out, use some warm water, soap, keep irrigating it. If you do have an ankle sprain or throughout your back, don't return to work too fast if you can. Don't return back to the gym or running or what have you. Give your body some time to recover.
Doctor, I'm not going to lie to you. Every time I hear somebody sneeze, I give the side eye. I'm like, I don't want to get close to that person because it's flu season, and I don't want to get sick. And I constantly use, hand sanitizer. I like to call it germ gel.
Yes.
So
good.
give me some of the tips that I should keep in mind from avoiding the flu and staying healthy.
No, great question. Number one, number two, and number three is exactly what you're doing. So wash your hands. Try to avoid touching your face, of course. Try to boost your immune system, and how you do that is plenty of rest, some light exercise, walking, de-stressing your life as much as you can. That can certainly help. And then if you are feeling a little under the weather, a little sick, wear a mask if you have to go out. Better yet, try to stay inside.
And you want to stay hydrated.
Yes.
Which, by the way, this is full because I already tried to steal it, people. I did. I was like, okay, that's really the doctor's water bottle, but it's cool. It's the Denver Health medical staff, and you guys do a wonderful job. I really appreciate you coming in today. Are there certain symptoms? We have like 60 seconds left, so I just want to find out, treating the flu versus an adult compared to a young child, what should we know the difference and when we should go to an urgent care?
Right. Another great question. So in general, if you are younger and you have the flu, more than likely you're going to feel pretty bad, but you're going to do just fine.
Right.
If you are, again, at the extremes of age, if you're older, please come in and see us right away. If we can see you right away, we can really try to stave off and prevent some of those other symptoms from happening with the flu and get you the help and care that you need quickly.
And like you said, get plenty of rest. Don't try and push yourself and go out to work and try and take care of things. There's time for you to sit down and rest a little bit.
That's right, exactly.
Okay. Well, thank you so much for coming on the show. I really appreciate it. And he's healthy. I shook his hand. I don't need the germ gel. If you need or know someone that needs expert urgent care, I really want to encourage you to contact Denver Health. Visit denverhealth.org/welcome. That's denverhealth.org/welcome if you'd like to learn all about their programs. And thank you again to Denver Health for sponsoring the segment.